with useful. We've confused shine at the end. So think about this. You've done all your hard work, you've made your notes, you've written your prescription, you've counseled the patient, and now you press AI assist. No, thank you. All they did was to move the AI assist button earlier on and give the user the option to use it whenever it made sense to that user, and the results changed. The fourth level is to what extent is the improvement actually going to yield an improvement in health outcomes? The reason we're all here is what's fundamentally going to shift. Is this going to help us get diagnose TB better or help with adherence in diabetes, etc. So these are some of the fundamental questions, and I think we've got caught up with investment at levels 1 and 2. Let's just check how this model works. Let's just check the product. And having really thought through and given enough investment into how this gets integrated into the workflow, and then ultimately, how does this shift outcomes over time? I think, Elaine, can I take 1 more minute and talk about verified AI? Should I come back to this? I was thinking to myself, and probably a bad analogy, but I'm going to put it out there anyway, because I'm flying this evening. That's why I didn't want to use it. But if I said to you all, would you fly if the likelihood of the flight arriving safely was 95%? I would fly. You would fly? If it was 95%? If I told you, if it was 96, 97, or 98, would you fly? No. Even if it was 99, just think for a second. If it was 99%, That means every 100th flight taking off from Delhi airport would crash. Who would fly? I didn't go, oh, right? Or we'll take some other means of transport. And the reason I'm emphasizing this is that when it comes to healthcare, the bar should be 0% risk of failure, 0% risk of error. And so Elaine and many other partners we're starting to have this discussion with is how do you get AI to be verifiable so that you know that whatever the input is, you can document that, it's transparent. And we spoke about this, which is can we shift the narrative from black box to glass box? Can we really know why did the model make a particular decision? We gave it X input, the patient had these criteria. Here's the logic model, and it gave that particular output. But when it gives that output, can we put some safeguards in place that makes 100% sure that it isn't prescribing something the patient's allergic to, or that's going to end up in a catastrophic event, or that's fundamentally flawed in its logic? And that's where we'd like to invite partners to work with us on a pathway to verified AI. Thank you.
And I can see Justice Singh also. Justice Singh is just nodding her head because I think, having that chain of proof is something that we like to have in legislation. So, it's always nice when there's a trail to follow to that decision. We couldn't have queued it up today because our next person I'm going to ask is Professor Dasgupta, who is a clinician and an innovator. I'm sure you've experienced the recalcitrance and challenge of shifting medical practice, and nurses and doctors are well known for being entrenched in the way of doing things, and often changing those well-trodden paths of workflows and clinical decision pathways are very difficult to shift. So what kind of investment do we need to make in clinical research and evaluation and evidence to shift those well-trodden paths of practice? Professor Dasgupta.
Namaskar, friends. You have to realize that I am a working surgeon. So in addition to invention and innovation, what I'm really interested in is implementation. I want to make a difference to you. If you may be patient someday, I want to make a difference to you. I come here on behalf of Responsible AI UK, a major investment from UK research and innovation, not just in AI in the UK, but into an international ecosystem, including the Global South. We have put AI champions in every hospital, and we are trying to expand into our partners in India and in Africa, where it is needed the most. Let me give you some real examples of how we are doing this. Responsible AI UK, for example, funded an evaluation of ambient AI, writing those notes, shortening the operating time, saving a month of wasted time in the operating room. The British Association of Physicians of Indian origin realized that wouldn't it be wonderful if our parents, many of whom are living in India, my mother is 87, before she has a heart attack, wouldn't it be nice if a message on my watch told me something was going to happen? The reason it doesn't happen is because the data is not diversified enough. Without diversity of data, you're not going to win this battle. Let me give you another example of investment, of inequity. 2 weeks ago, if you look at the British Medical Journal, there's a major article from us on telesurgery 2.0. It means today the technology exists for a surgeon to operate from 2,500 kilometers away using a robot with a time delay of 60 milliseconds or less. We have done this. It feels like you're in the same operating room. Imagine this investment being one of the solutions to the 5 billion patients who do not have access to equitable surgery. That is an example. Let me give you a third example. And this is in automation. My own group in King's has funded and invested in automation big time. The levels of autonomy in robotics go from 0 to 5. 0 is no autonomy. Most autonomous machine is level 3. You map with the ultrasound, the prostate. All the men in this room have a prostate. As we grow older, we have difficulty in peeing. You map the middle of the prostate with an ultrasound. You press a button, a water jet creates a hole in the middle of the prostate so that you don't have to wake up 20 times at night to pee. Until last November, when University Allen presented a paper on a robotic system which can operate on pig gallbladders. Pig gallbladders with 100% no failure, 100% accurate. 5 days after this, I was at the Royal Academy of Engineering, a group like this, 200 people, and I said, hands up, everyone who is going to allow this machine to operate on them. So, hands up, everyone who will allow a completely automated machine, 100% accurate in pigs, to take out your gallbladder here. Any takers? There was one hand in the room. On that occasion, there was a single hand in the room. So he is doubtful as well. So they want to be part of trials, but they are saying not yet. They still want a human still today. So I to you, companies, of course, we have to work with them, countries, including the global south, but civil society, the 3 C's. If we do not bring our patients with us, all this investment is going to fail. And the final investment I would urge is in skills. There are hardly any medical or nursing schools in the world which have AI in the curriculum. If we do not have this embedded in the education of the next generation of healthcare workers, we are going to fail. So those would be my parting thoughts to you. Thank you.
The panel a few more moments. We've got the systems that need to be upgraded in order for them to be robust for the future that's coming. And then from it, we heard about AI as a game changer. Finally, we should be not just thinking about technology as a band-aid, but technology as a pillar of health systems of the future. But we shouldn't confound, as Zamir said, shiny and impressive with impactful, focusing on things that get used and work in the real world. A benchmark might be the wrong thing, not accuracy, but actually impact. And then, of course, the challenge that Professor Dasgupta brought to us, that it does take time to change behavior, but it is possible as long as, for the moment, we have humans in the loop. I'd like to give each of you one sentence now, just to wrap up, as you've heard others. What has changed your thoughts, and what's the one message you'd like to have folks leave the room with? And let me just go sequentially down the road.
leveraging our diverse skills and strength and priorities into collective action. That is partnership. So I recall some years ago with partners, with funders, we developed something called the principles for donor alignment for digital health. Because of the fragmentation, I would like to revive those principles to be able to work together to be behind countries' priorities. At the same time, countries need to have priorities and strategies and deliberate investment in enabling the environment. So donors cannot rally behind nothing. We are asked to rally behind countries' priorities. Those countries need to have priorities. So it goes both ways, right? So for donors, we need coordinate. Countries need to develop strategies, priorities, and investment so we can rally behind.
Fantastic. EDG.
Yep. Thank you. I think we were asked to respond in one sentence. So
I was going to say, a Norwegian sentence seems to be wrong. A Japanese sentence. So let's hear the.
But I haven't changed my mind. But one point which resonated to my heart, which I was not able to mention in my opening sentence. But one thing I'd like to highlight is that, okay, we can leverage artificial intelligence with human being at the center of those utilization. So that's what I want to highlight. Thank you.
Justice Singh.
I'm going to actually say one sentence. Here's to a healthier world. With AI and technology, we really hope to have a healthier world.
Fantastic. Professor.
For AI to work and really work for our patients, I urge you to follow what we call the Weizenbaum test, which means do not just think about what these machines can do for us, but think about what are the societal effects of these machines. The change has to go from the Turing test to today, the Weizenbaum test.
Very nice. Zamir?
Lena, I think for me, the question of how do we move from promise to progress is underpinned by, I think, a theme that I'm seeing at the conference. And the change that we need to support through that process. And so my appeal is we need to keep humans at the center of the AI revolution.
Fantastic. So, Peyton, you've been patiently these wise words from our panel. I'd like to give you the last word to bring this home and really feed the audience with food for thought before they go for food for their stomachs.
Thank you very much. Good afternoon to all. Sincere thanks to all the, I think it's on, yes. Sincere thanks to all the distinguished panelists for this very thought-provoking and very interesting conversation around AI and health. I think today's conversation makes one thing very clear. AI in health has reached an inflection point. And for years, we spoke about possibility. Today, the conversation has shifted to investment, implementation, and impact. I think that was really highlighted and emphasized by all. The question is no longer whether AI can improve health. The question is whether we will invest in the right foundations to ensure it improves health for everyone, not few. Over the past hour, several themes have emerged. And the first is around investment. Investment must go beyond innovation. It must flow into the systems that make innovation safe, trusted, and scalable through governance and regulation, evidence generation, workforce readiness, and also workforce capacity building, which came very clearly, data systems, and long-term partnerships. These are not optional. They are the enabling conditions that determine whether AI becomes a tool for equity or a driver of new inequalities. Second, predictability builds confidence. When countries strengthen regulatory and legal frameworks, investment flows in. When evidence is generated and transparency shared, investment grows. When partnerships are built across sectors, investment scales. In short, trust is the currency that unlocks sustainable investment. So I think these are some important points that I could take out from here. And we look forward to working with different partners, investors, donors, government agencies to take AI and health further for the benefit of all the populations. Thank you.
Fantastic. Let's give a round of applause to our audience on panel. And we're going to get a quick picture. So please, let's come to the front. And thank you all for your patience and apologies for going 1.2 minutes over. Thanks. 32, my friend. Hey, how are you?
I need.
I'm in the next panel. Thanks so much. Krishna everyone. For the previous session. If you're not staying back for the next session, we kindly request you to vacate the seats for all the attendees who will be attending the next session. We'll be starting our next session within the next 2 minutes. So I kindly request those who are here to attend the panel AI for Viksit Bharat, the capacity building imperative. Please take your seats. A polite reminder, the first 4 rows are reserved for special invitees from Capacity Building Commission and Catalyzing Bharat. Thank you so much. Good afternoon, everyone. Sincerest apologies. As is the case with such summits, and with so many exciting conversations happening in every room, we tend to run over. So we'll be starting with the next session very soon, within the next 2 minutes. I kindly request everybody who's here to attend the event on AI for Viksit Bharat, the capacity building imperative, to please take your seats. Just a polite reminder, the first 3 rows are reserved for special invitees from Capacity Building Commission and Catalyzing Bharat.